Penicillin, one of the greatest medical discoveries of all time, revolutionized the fight against bacterial infections. First discovered by Alexander Fleming in 1928, this antibiotic has saved millions of lives. But did you know that penicillin isn't just one drug? It's actually a group of antibiotics, classified into different types based on their spectrum of activity and resistance to bacterial enzymes. Let's explore the classification of penicillin and how each type plays a role in modern medicine. Narrow-spectrum penicillins. The earliest form of penicillin, known as natural penicillins, includes penicillin G and penicillin V. These antibiotics are most effective against gram-positive bacteria, such as Streptococcus and Clostridium species. However, they are easily broken down by beta-lactamase enzymes, limiting their use against resistant bacteria. Alright. Now we will make a fun mnemonic that will help you memorize all these crazy pharmacology facts. Welcome to our artistic street of penicillins. But wait, something's odd. This street is narrow on one end and broad on the other. And guess where we are? Right in the middle, because today, we're talking about narrow-spectrum penicillins. Look over there. An artistic girl stands in the middle of the street. She's holding a giant pencil, sketching something incredible. But this isn't just any pencil, it has a big GV logo on it. Why? Because this is all about penicillin G and penicillin V. Now, let's take a peek at her painting. What has she drawn? First, we see a sparrow, perched gracefully, representing spirochetes. Next to it, there's a nest, a clever symbol for Neisseria. But look closer, she's taken a bite out of a pie cake. That's our cue for Streptococcus pyogenes. And there you have it. A fun, artistic way to remember narrow-spectrum penicillins and the bugs they fight. Next are very narrow-spectrum penicillins, aka penicillinase-resistant penicillins. To combat beta-lactamase-producing bacteria, penicillinase-resistant penicillins were developed. Examples include methicillin, nafcillin, oxacillin, and dicloxacillin. These drugs are primarily used to treat penicillinase-producing Staphylococcus aureus infections. Welcome to this journey through the very narrow-spectrum penicillins, an essential group of antibiotics used to combat staphylococcal infections. To help you remember them, let's take a walk down our artistic penicillin street, where vivid imagery meets medical knowledge. Now, we are in the very narrow part of our artistic street, where our story unfolds. First, we see a napping fox, curled up and sound asleep. This napping fox represents nafcillin, a key member of our antibiotic family. Look closely, and you'll notice something unusual. The fox is wearing a digital clock. This glowing digital clock serves as a reminder of dicloxacillin. Just a few steps behind, we encounter an ox, symbolizing oxacillin. On the ground, there is an analog clock, a clear reference to cloxacillin. The fox, still immersed in study, has fallen asleep over complex math equations. This final detail represents methicillin, completing our list of narrow-spectrum penicillins. Now, let's connect these images to their clinical significance. The tranquil aura of this street sets the stage for Staphylococcus aureus, a key target of these antibiotics. Meanwhile, the fox's leather jacket serves as a visual cue for Staphylococcus epidermidis, a common skin-associated pathogen. Through this vivid scene, we've linked nafcillin, dicloxacillin, oxacillin, cloxacillin, and methicillin to their names and purpose. By simply recalling this artistic penicillin street, you can quickly and confidently identify these essential antibiotics in clinical practice. Now, the next time you encounter a case requiring narrow-spectrum penicillins, you'll remember this street and the lessons it holds. Next are the aminopenicillins. A broader spectrum of activity is found in aminopenicillins, such as amoxicillin and ampicillin. Unlike natural penicillins, they are effective against some gram-negative bacteria like Escherichia coli and Haemophilus influenza. However, they are still vulnerable to beta-lactamases and are often combined with inhibitors like clavulanic acid or sulbactam. Now for the mnemonic. Welcome back to our artistic penicillin street. This time, we're in its broader part. Here, we meet a mockingbird for amoxicillin. The mockingbird sings a gentle lullaby to its baby, reminding us that amoxicillin is safe to use during pregnancy. But they are not alone. In the shadows, a magpie, for ampicillin, watches intently. It is drawn to the song, an omen of listeria, silently listening, waiting. Before them, a dish sits in a plate, a feast symbolizing the GI tract infections they combat. The salmon fish, glistening in the dim light, salmonella. A shellfish, delicate yet dangerous, shigella. The air grows heavy. On the ground, an ominous sight, a large axe, its blade stained with blood, a grim reminder of Moraxella and Haemophilus. Above them, the rhythmic thrumming of blades cuts through the silence, a helicopter hovers ominously, an ever-present shadow of Helicobacter pylori. This is no ordinary street. This is Penicillin Street. And this is how we remember amoxicillin and ampicillin. Finally, the most advanced group is the extended-spectrum penicillins, including piperacillin and ticarcillin. These antibiotics are designed to combat Pseudomonas aeruginosa and other tough, resistant bacteria. They are often paired with tazobactam to improve their effectiveness against beta-lactamase-producing organisms. Welcome back to Penicillin Street for one last visit. This time, we step into the broadest part of the street, symbolizing the extended-spectrum penicillins. Here, standing in all his glory, is a tiger, the perfect representation of ticarcillin. But look closely, he's holding a pepper shaker, a playful nod to piperacillin. These powerful antibiotics are known for their effectiveness against a particularly troublesome resident, Pseudomonas aeruginosa. And who better to embody this cunning bacterium than the one and only Mona Lisa, standing right there with her mysterious smile? As we take in this final scene, let's remember the strength and reach of extended-spectrum penicillins, expanding our defense against tough bacterial adversaries. And with that, we bid farewell to Penicillin Street, a place where art and antibiotics come together in perfect harmony.